Hi everyone, and welcome to Health Equity Teachers video on addressing healthcare needs for veterans. This is the second of a two-part video series for caring for veterans. My name is Colleen Wong, and let's get started. So here are the objectives for this module. List the demographics of veterans in the United States, describe what the VA system is and how it delivers healthcare to our veterans, describe health disparities and health issues of importance in the veteran population, compare the substance use and mental health of veterans to that of the general population, discuss homelessness in the veteran population and the efforts to mitigate homelessness in your state, and list resources to address inequities facing veterans. Like we talked about in the previous video, suicide rates are higher for veterans than in the general public. And so the VA is always striving to prevent veteran suicide. For the purposes of this video, I wanted to point out that the VA website has a section dedicated to mental health, suicide prevention, and it has resources to help those who are dealing with suicidal ideations. As we know, homelessness can affect anyone, including veterans. Veterans face unique challenges when it comes to finding safe and affordable housing. And these challenges can include economic hardships, multiple and extended deployments, as well as a range of mental illnesses. 3 states, Delaware, Connecticut, and Virginia, as well as 78 communities, have virtually eradicated veteran homelessness within their borders. In response to veteran homelessness, state legislators have introduced 79 bills, 17 of which have been enacted into law that directly relate to homelessness of veterans. So the state legislation predominantly focuses on home loans, rental protections, and adapted housing in order to mitigate this problem of homelessness. In terms of a federal response, the U.S. Department of Housing and Urban Development and the VA Supportive Housing Program, so this is called the HUD-VASH program, through public housing authorities, has been able to provide rental assistance vouchers for privately owned housing to veterans who are eligible for VA healthcare services. And another federal program is called the Grant and Per Diem program that provides funds to community agencies to provide services to homeless veterans. Additionally, the VA website has a webpage dedicated to resources geared towards homeless veterans. There are many state and federal resources geared towards veterans as well, and these resources can be programs and things to help with social issues. They can be support groups, and they can even be just information that can benefit veterans. So veterans can get information through a variety of avenues. Most states have a 211 page for veterans, and this will provide state-specific resources for that veteran. Most states also have a State Department of Veteran Affairs, which again will provide state-specific information and resources to veterans. And you can always also call the VA Center of your state, and you'll get resources for your state as well that way. Additionally, there are federal resources that can benefit veterans as well. Veterans can be referred to the VA for primary care, and through that be connected to hundreds of programs, or they can self-refer by calling the VA Center for their state and be referred to these same programs as well. There are also community support groups and programs available to help veterans as well. You can locate these support groups and veterans using findhelp.org. Additionally, different professional organizations have programs and resources geared towards veterans as well. So the National Veterans Foundation, the Coalition to Salute America's Heroes, as well as the U.S. Department of the Interior, all have web pages of resources geared towards veterans.